Hospital in Oman. Alinda from Indonesia, and he is a young nurse and joining us also in the session. For the people and or our audience, you can submit any question in the chat box and we will receive it and answer it later. Now I would like to invite first our Haifa Al-Saadi. Welcome, Haifa. Can you, Haifa, share with us Oman experience during COVID for you as a nurse?
Thanks, Ms. Amna, and greeting for all. With you, Haifa Al-Saadi, I am a clinical nurse specialist in critical care and emergency department. Initially, I would like to thank WISH for their continuous effort and support towards empowering nurses, not merely in Qatar, but including all the world, which join all nursing under one umbrella that aim for nursing empowerment, advocacy, and involvement in the decision makers. I would like also to thank WISH for inviting me, and I'm glad to be here. And what a great experience actually we had in Geneva during the World Health Assembly. It gave us a time to rethink about ourselves. It gave us a time to strongly believe in ourselves and advocate for our nursing profession in our country. So actually within 5 minutes, I will give an overview about the healthcare system, nursing in Oman, and also about my experience as a young leader during COVID-19. So the healthcare system in Oman has been under dramatic changes since 1970 up to today, due to wisdom of Our Majesty Sultan Qaboos bin Said. He was strongly believed that the success of his country is by investing in young Omani workforce. And by the way, today we are celebrating our 50th National Day, Alhamdulillah. In terms of nursing, the Directorate of Nursing was founded at the Ministry of Health in 1979, which helped to recognize the nursing in Oman and became a cornerstone of healthcare system. In 2014, the Directorate of Nursing and Midwifery was upgraded to the Directorate General of Nursing Affairs and it was led by Dr. Majid Al-Muqbali. Oman faced similar issues in terms of acute shortage of nurses, so we were trying to close this gap by recruiting nursing from different countries. However, Ministry of Health actually have a tremendous effort in order to train our nurses in different specialties. And I am proud to say that in Oman, Omani nurses represent about 60% of nursing workforce in Oman. What a great achievement. That's in general about the nursing profession in Oman. And now I'm so glad to share my experience with COVID-19. I am honored to be posted as the head of nursing in Field Hospital, which is a national project, and it has a total of 300 bed capacity, and we're looking after critical to moderate COVID-19 patients. Being in this post is a huge responsibility, and obtaining this type of support and trust from higher decision maker in the Ministry of Health, either by Director General of Nursing or the Minister himself, it empowers us as a young nursing leaders. It provides us a room to fly, to innovate, and to think out of the box. Yes, it is. Being a head of nursing in Field Hospital, it is a totally different scenario. It gives us a chance to gain new skills and leadership and management. It enhances our networking, critical thinking, and communication at all aspects. I am so proud that even I have a chance to select my deputy and my ward in charges, and all of them are young Omani nurses who they are not officially in the management position, but they have the potential to be a leader. Our journey in Field Hospital provide for me and for my colleagues opportunity to be involved from the first step of establishing Field Hospital. We reviewed the map. We have been involved even in identifying the resources, the required items, all of that. Being here give us a great time for continuous learning process and developing our leadership and management SOP that's suitable for our pandemic COVID-19 and the structure of Field Hospital. Actually, it enhances our communication skills and promote culture of non-blaming. It gives us power to advocate for our patients as well as for our nursing. This journey definitely will have a positive impact on us at the personal level and also at the professional development level. So that's in a brief about my experience as a head nurse, as a young nurse leader in Oman during COVID-19. And I had one question. I don't know, Ms. Amna, if you want me to ask now or later. Okay, so my question for our guest, do you think that the role of young nurses, young and senior nurses during pandemic COVID-19 has an impact in empowering nursing profession and amplifying the young nurses' voice? Thanks a lot.
Thank you, Haifa. I think we will make at the end time for all the questions, and your question, I think we will take it to the end, and it will be answered all by Ms. Maureen. Now I will go back to Manish from Zimbabwe, and he's also a representative for Nursing Now, and I believe he had a lot of experience. We actually prepared for you a lot of questions. We would like you first to talk about your experience in COVID, and we have a question for you. How did your experience influence you as nursing leader?
Sure. Thank you so much, Abna. And it really is great to be able to be on this platform and really to be able to share about experiences that we have all had as young nurses with regards to responding to COVID-19. Because I think one key aspect is that COVID-19 really came out of nowhere. And to see the way that young nurses have come up to respond and really also be able to provide ideas and innovations in responding to this pandemic has really been amazing. So I'm a young nurse and I'm from Harare in Zimbabwe. And initially, when COVID-19, the pandemic came in and was first discovered, there was a lot of fear that spread around the community, mainly because people were not aware as to what exactly COVID-19 is and really how the disease was going to be managed, the pandemic was going to be managed within the country, mainly because of lack of access to funding within the country, issues to do with the economy, issues to do with the health system. So initially, when the pandemic started, we found that a lot of cases started coming in, and health workers, particularly nurses, doctors, all health workers, were really afraid of being able to intervene and provide interventions for the pandemic. What young nurses did, young nurses got involved and they decided to come up with education material. And this education material was available to communities and being able to advise communities about what exactly COVID-19 is and trying to dispel some of this fear. So being able to inform the public of what exactly the disease is about and how to prevent it. Particularly when we went into lockdown, being able to move from communities and going into communities and sharing about social distancing, sharing about being able to sanitize your hands, and also sharing about trying to inform the public about what the measures that have been put in place by the government. We found that this education really helped the community because the community was more receptive and the community was actually able to understand more about what COVID-19 actually is. So those have been a few of the experiences that we have had with COVID-19 in Zimbabwe. Currently, in terms of cases, our cases have really been quite a few. So we found that people are able to move around more. The lockdown has been lifted, which has been great in being able to encourage interaction between people and also to assist with a lot of mental health issues as well that had started to come up, particularly when people were in lockdown. So those have been some of the experiences we have had with COVID-19.
Thank you very much, Manish. We have a lot of questions for you. We will come back to you and Haifa. Hello, Alinda. Yeah. Linda, we would like to hear from you. You are a young nurse and you were being also selected to join us today. Can you just give us a brief 5 minutes about your experience during COVID?
Thank you very much.
I think you are mute, Linda. Can you check, please?
Don't you hear me? Can you hear me? Not muted actually. Can you hear me? Can you hear me? Oh no, I'm already pressed unmute. Hello?
Yes.
Can you hear me?
Yes, now yes.
So I think it's clear. Okay. So first of all, thank you very much for giving me this opportunity. Actually, maybe three of you are the youngers who attend the World Health Assembly last year. But actually, I supposed to went to Geneva this year, but due to the COVID-19 pandemic, it was postponed. It was a little bit disappointed for me, but actually, anyway, we have to keep move forward because Indonesia itself, this is the challenge is very challenging. It's very tricky since uh, the the emerging disease is something that we didn't expect to come this year, right? And currently, I'm working as assistant for collaboration and development in the Department of Nursing, Universitas Gadjah Mada. And I believe that 5 minutes is not enough if I want to share my experiences during the COVID-19 pandemic. Uh, yeah, because since I work in university, and then uh, the University of Gadjah Mada in Indonesia, where I belongs to, we developed the COVID-19 task force, and it's like a response team to respond to COVID-19, and it is initiated by. Is there any problem with my microphone? Could you hear me?
Yes, we
Okay,
can hear
Yeah.
you.
okay. Because I see on the chat that someone give a notification. And during the hard time, the pandemic COVID-19, I voluntarily proposed to the university to become the contact tracing officer, and also case management for several cases in Yogyakarta. So actually contact tracings. Why I assign myself in the contact tracings? It is very eye-opening because uh, at the early phase of the COVID pandemic, everyone's in the community, the population, the society is very afraid of this new emerging disease. And my role as the contact tracer and the case managers is really help them to give them health education, especially for the people who are exposed by someone who suspected to have a COVID-19, and someone who exposed by the population who are positive COVID-19. And in this moment, I giving the holistic care approach, like giving them health educations. They because people, the community tend to it's like they have no idea what they have to do, and uh, during the contact tracing processes and also the case management, I help them uh, to give them suggestion what they have to do. If you are being exposed, you can go check to the health facility which provide you to have a swab test, so that you could know your status whether you are infected or not. But since our capacity of the testing at the early phase of the COVID-19 is very limited, so the what's that the priority is someone who are older population is also the vulnerable population. So that's why for like students or the young people, we are tend to give them advice to what's that to be in self quarantine and self isolation so that they could manage themselves. And this is very important when you are in the self quarantine and you cannot contact with the other persons outside. It is very essential for me as the case manager and contact tracer to to talk to them what can they do, and then to monitor the progress of the disease that they have. And also in responding to the the funding issues at the early phase of the COVID-19 response, we, the alumni of the School of Nursing, also concocting fundraising platform team to support our colleague in frontliner to so that we collect the funding to collect money from everyone from our society which willing to help, but they don't know how they could help. So we manage the money, the funding, so we could with that we could distribute it to the hospital, which is the hospital is very like of the financial. They have a finance they experience financial issues during the early phase because very limited budget for personal protective equipment, something like that. So that we manage the money from our society and then we distribute it to our hospital under academic health system. And I found it's very it's very fruitful discussion and also coordination with all the hospital with the chief nurses in each hospital to have collaboration with my team. And maybe that's all that I can share with you. And thank you very much.
Thank you, Alinda, for sharing your experience. Sarah, are you live, Sarah? Sarah should just join us, and she is also a young nurse from Canada. I think she's okay. So now we would like to welcome Ms. Maureen, and we want you to share with us your experience with nursing now and why you are so passionate about nursing now.
Well, thank you, Amna, and thank you to all of the young nurses. I'm the old nurse on the panel. So my experiences go very far back. I wanted to start before COVID to just give you a sense of how I learned to influence. And this is before Nursing Now. When I was a young nurse, many years ago, like you, I was working in an intensive care unit. And I would, the hospital where I worked had built a new wing, and you walked every day through a new pediatric unit to get to the intensive care unit. Every day I would walk through a pediatric unit that had maybe 2 patients, very empty, to an ICU that was overflowing every day with patients who couldn't be admitted. It was always overfilled. And I learned, this is how old I am, about telemetry and progressive care units. And so I went to the head nurse and I said, I think we could take the pediatric unit and make it a progressive care unit, which would smooth flow for the entire hospital. And the head nurse said, we can't do that. And I wouldn't take it. So I kept going up and up till I finally walked in one day to visit with the chief executive, the CEO of the hospital. And I said, I have a great idea on how to solve this flow problem. And he laughed at me and had me taken out of his office. So the next day I went back again and he said, I'll tell you what, if you can go to the pediatricians and convince them to move their unit to the old part of the hospital, then you can have that unit. So I went to the pediatricians meeting and they laughed at me. A nurse coming to a pediatricians meeting, telling them to move to the old part of the hospital. And so I went back again the next month and I told a story about a patient in the intensive care unit. I told a story about a patient in the ICU who, in the emergency room who couldn't get admitted. And I could see some of them leaning into me, but they still told me to leave. The next month I went back again and I said, it's not just those people. And I extrapolated to the total population of people who were impacted by these flow problems. Some people related, but many didn't, and I left. The next month I went back and I talked about the human cost of families and patients being separated because the patients were taken to another hospital. And finally, I went back the next month and I learned that in order to influence leaders, you have to start with a story, extrapolate to the total population, tell the human cost, and then extrapolate on the financial cost. So I became proficient in using this arc of saying patient story, extrapolate to the total, human cost, financial cost. And I realized when I spoke that way, I could influence everybody. And so they moved out of the pediatric unit and I got to build the progressive care unit. And it changed so much that I feel like people in the hospital began to look to nursing for solutions, not necessarily just to surface problems. A few years later, when I was 34 years old, I was asked to be the chief executive, the CEO of another hospital. And I really do attribute it to people beginning to hear the voice of nursing. So when Lord Nigel Crisp called me and said he wanted to talk about how we changed the status of nursing worldwide, I joined him right away and began to think about how do we create influence across the world. It's been an amazing adventure to work with Barbara Stilwell and Lord Nigel Crisp and many others, many of you on this panel around the world. And what I'm seeing is now, especially in COVID times, the profession of nursing in the United States is the most trusted profession, not only in healthcare, the most trusted profession of all professions. So just as Alenda was saying, just as Menashe and Haifa was saying, the public are looking to us now in COVID times. They're listening and they're trusting us more than they are political officials, more than they are physicians who are sometimes giving different advice. They're coming to nursing, and it's really filling my heart with joy to see the profession raised up because people are coming to us, people are trusting us to have that communication and that influence on them. Let me stop there, Amna, and see if there's any questions you want to ask me or others on the panel.
Yeah, there's a question from Barbara. She's watching us, I think. She sent a question. Do you think that post-COVID nursing will be an attractive profession for young people? Or does it appear to be too stressful and difficult? How can we support young nurses at this stressful time?
Well, I'll start and then open it up to others. But I do think that although we're seeing nurses in working under COVID, working in situations, the word that's often coming up is heroic. That nurses are working in a heroic mode to save other people's lives. Many times they're having to stay over at the hospital to prevent bringing a potential COVID back home. They're working long hours. They're doing two things that I think are so critical. They're caring and they're connecting with compassion. As Menashe was saying, it's not just the physical caring that they're doing so well, but it's the mental health of those patients and the stress that's on families. And people are looking to nursing. Although the stress is acute, and I really worry about the mental health and the physical health of nurses, I do think that we're creating a professional, an attractive profession for the future, because people are seeing the hierarchy dwindle away as nurses step up to do physical care in a way that they never have, and with compassion to reach out and take care of everybody. Menashe, why don't you respond, and then we'll go through the rest of the group.
Yes, sure. Thank you so much, Maureen. And I think the way you put it really highlights it well, that with the COVID pandemic, there has really been a lot of focus and a lot of emphasis on nurses. And that has really helped us in being able to highlight who nurses are and what exactly they are doing. how they really get involved within communities, and the work that we're doing, that really in society that is being called heroic. I know in a lot of societies, and in many different countries, there've been claps for nurses, people clapping for nurses and other health workers that are responding to the pandemic, which has really helped us in highlighting nursing as an attractive profession for young people. And that has really been able to assist in really getting a lot of young people engaged and really finding out more about what it takes to become a nurse and what it involves to be a nurse. There still is a lot of work to be done as well, in being able to highlight in what some of the challenges as well that come with being within the profession as well. But there has been a lot of progress in terms of really raising the profile of nurses and really encouraging a lot of young people to choose nursing as a profession.
Thank you, Manish and Maureen. Just what you said, it's also the same what happened to us here in Qatar. Actually, I'm very proud that I am a nurse, maybe more than ever, that I am a young nurse and I was part of this COVID pandemic. When he said they were clapping for nurses in Qatar, they called the healthcare as the white army. During COVID, actually, we deployed more than 13,000 nurses to provide essential services for thousands of patients in Qatar related to COVID-19. And what I am really proud of that our state of Qatar involved nurse-led from our Qatari nurses to be part in the system-wide incident command and to have her voice and being like chosen as a nurse to lead. And this proved that nurses not only effective and compassionate at the patient bedside, they are also important in the boardrooms as well. And I am really proud that during this COVID, all the nurses, they showed the courage. They accepted their new routines, their new delegation. They went from different routine to ICU, emergency, field hospital, swapping. They cover almost the whole routes. Many care, like at the same time, we were like, we want to take care of COVID, plus we want to continue our other operational cases, which is coming with non-COVID cases. Still, we have other diagnostic and all. It was difficult to balance, but really in Qatar, we run it very smoothly until we flatten the curve. So I think whatever all of us we went through, that I think now all the governments know the importance of nursing, and they need, I think, to invest more in nursing.
Can I just add one point? I think one of the things that I've seen is innovation during this time of COVID. There are some nurses who in the United States who weren't doing their regular jobs because elective patients weren't coming to the hospital. And so they created a compassion team. And they began to take care of not only patients and connecting them with their families when visiting hours were limited, but they were also creating compassion teams for each other. And so I really do think that reaching out was incredible. And they never stopped the Nightingale Challenge. In hospitals around the state of Indiana, they created a passport to leadership. Every nurse could get, a young nurse could get a passport, and they got mentoring and they could go to classes. So we never stopped developing them because it's so critical now that we continue to build young nurses into leadership positions, just like I had the opportunity when I was young. That sense of trust and development, I think, is probably more critical now than ever.
Yes, you are right, and I think nursing now, Nightingale Challenge, it will be like it is not only a period of time, we will continue doing that. And that's why it started from the beginning. Can you just talk to us a little bit, Maureen, about how you influence others from your experience?
I think the influencing, I think what nurses are so good at is telling the story of clinical excellence, like the science of taking care of patients in a pandemic. I think we're able to articulate that to the public and to other professionals. So we're able to bring a team together and tell a story about human need and compassion in a way that comes from our hearts. It comes from why we all joined the profession of nursing. And then this idea that I laid out earlier of then moving from the compassionate story to the data and the clinical need. And also, I think the more that we are able to link quality improvement, telling stories in finance, the more we're going to get ahead quickly, because we'll be bilingual, so to speak. We'll be able to speak to everybody from the human side and the finance side. And I think that's going to help us to get more nurses into leadership positions. Maybe Haifa, would you want to add, or Linda? Haifa, you're still on mute.
Haifa, you are muted. Can you please unmute?
Okay.
Maybe Alenda could go while
Okay.
Haifa's unmuting.
Okay. Could you hear my voice? Okay, so maybe I will add something. It's very from what Maureen said, that the innovations could influence others too. And from my experience, how we influence people with different background is that we should setting up our own goal first, and then we discuss it with the other people that we want to influence. Do we have the same goals or not? We have the same goals to raising the nursing profile, the nursing profession globally, right? So we need to really make ourselves, to ensure ourselves first. What is the step that we have to take to reaching the goal, and then if we already believe from what so if we already believe from the beginning, and then we start talking to share what is our concern to the other people, and then why we have this kind of goals, and I'm sure they will be influenced, and they will interest with our, and we also have to provide the data also why this important and why we have to move forward to raising the nursing profile. Maybe that's my additional. Maybe Haifa wants to add something.
Me now? Yes, you can hear me.
Yeah, we can hear you now.
Yes.
Okay. So yes, I agree with all of you. COVID-19, although it is considered as a stressful situation, it's considered as a disaster, but it opened for all nursing profession. It raised the nursing profile. It gives the chance for innovation. That's what happened even in Oman. I totally agree with you. Due to COVID-19 increasing cases of healthcare providers, including nursing with the positive COVID. So we were in need to deploy nurses and to move them, for example, from primary healthcare, although before they are not looking after critical care patients. But because of COVID, we were in need to pull them. So yes, COVID-19, although it's a stressful situation, but it makes us to think in outside the box and to think in an innovative way. Thanks.
Ms. Maureen, what do you want to give advice for the young nurses? And also, I want your advice for the leaders. How to keep empowering the nurses, how to keep guiding them.
Well, for leaders, let me start there because I have a lot of passion, I think, for leaders reaching out and taking care of nurses in a new way. This is a time when leaders need to connect with nurses physically, they need to make rounds and understand what it's like on the units, what it's like in the emergency departments, what it's like in the community, for nurses who are reaching out into patients' homes to take care of them around the world. And I think the first thing leaders need to do is take care of those nurses' physical and emotional needs. I chair the board of an organization here called the Wellbeing Trust, and we're working on mental health and resilience for all of our healthcare workers right now. And I think leaders need to understand what they can do to support the mental health and resilience of nurses. They need to understand how they can protect their physical health by getting them proper PPE and psychological PPE. At IHI, we've been doing a lot of work on psychological PPE, and nurses are doing donning and doffing, not just of care and equipment, but also of the stress that they're working. What can I leave behind as I'm going home? And what am I coming back into that I'm worried about? I think those psychological PPE conversations are critical. And then what I want to do next is I want to continue to develop young nurses around the world. This is our opportunity to strengthen the profession in a way that will help us all going forward, mostly me, the older nurse.
I think still Haifa have a question. The role of young and senior nurses during COVID has impact in empowering nursing profession and amplifying young nurses' voices. What do you think about that?
Again, I'll start and I'll say that I think one of the leadership roles that we can all play is not to be the only voice in, as Menashe said, in the boardroom or on the front line. I think the best leadership activity now is when asked a question or when facing a challenge, for that leader to turn to a young nurse and say, you tell me what you're seeing, just as all of these young nurses have told us today. You tell me what you're seeing. You tell me what you think will help care for patients. You tell me how we bring compassion to the job, and that's my job to support you. But getting that voice of a nurse into the boardroom is, I think, absolutely critical.
Thank you, Maureen, and all the audience being with us in this 45-minute session. It's finished very fast. Actually, I think all the nurses demonstrated the resilience and the skill necessary to deliver high-quality care. I think all of us were proud of what we done during COVID and the hard work by the frontline people, setting up system and process and delivering clinical care and operational leadership at the same time. We should be the voice to empower everybody around us. Even for us at this post, we should now empower the young nurses by years. We should learn from our experience and what we are going through and empower them all. Anybody want to say anything before the closing?
I want to say thank you to all the young nurses in the world, every nurse who's working around the world. I have never in my long career seen a time when people have been so generous in spirit, so generous in knowledge, and reaching out to just open their arms to their other team members. Nurses are bringing teams together like never before from across professions, but in ways that I hope we never lose. I would just end by saying that we've learned a lot, we've innovated a lot, we've created new ways to care and offer compassion, and I hope we never lose them. I hope we go forward and keep everything we've built in this time of crisis, because this is what we need for the future.
Thank you, Maureen, and thank you all the team, Monesh, Haifa, and Alinda, Sarah, for being in this session, amazing session. Thank you very much.
Thank you.
Thank you.
Thank you, everyone.
Thank you.
Thank you.
Thank you all.
Thank you, Maureen.
Thanks. Great to see you.
Great to see you all.